Hello everyone. Today we talk about common obstetrics and gynecology terminology. This is an important question in the basic obstetrics and gynecology exam. That's especially that for those coming to the department for the first time. It's also important because when we speak the same language, we understand each other. Everyone understands what you mean, and there's no confusion in that. It also makes us sound like we belong. We all know what we are talking about. So we'll talk about that today. So let's start with the big terminologies, gynecology and obstetrics. Gynecology refers to the study of diseases of women that are in the genital tract generally. So diseases of the genital tract of women is studied in this branch called gynecology. Gynecology also includes pregnancies, problems in early pregnancy really. So we can talk about gynecology to include things like ectopic pregnancies, miscarriages, molar pregnancies, and so on, because those are early pregnancy problems and they belong to this branch called gynecology. Obstetrics, on the other hand, is the study of problems associated with childbirth. So problems associated with childbirth and also problems that are related to late pregnancies. It also includes study of problems that are related to the puerperium. So the puerperium is that period from the point a woman delivers her baby to about 6 weeks post-delivery. That is called the puerperium, when the woman is the physiological changes of pregnancies are reversing back to the non-pregnancy state. That is what is called the puerperium. A pregnancy that has not gone beyond 8 weeks is called an embryo. Once it goes beyond 8 weeks, it's termed a fetus. So the fetus remains a fetus up to the point before delivery. Once it gets delivered, that becomes now a neonate. A neonate is a newborn baby that is less than 28 days. If it's up to 7 days, we call it an early neonate. If it's up to after 7 days, we say it's a late neonate. An infant is really an extension of a neonate. So from 0 days after birth to about a year, that would be what would call an infant. So it's important to take note of these and not just use the words interchangeably. The other terminology we need to look at is infertility. So infertility is failure to conceive after regular unprotected intercourse for a year. So there is what is called primary infertility, which is infertility in a couple that has never conceived before, or it can be called secondary infertility, that is infertility in a couple that has achieved a pregnancy previously. So that is what infertility is. Subfertility is more the preferred term at the moment. The reason is because infertility sounds very terminal. It sounds like someone will never conceive. But we know that fertility is really a spectrum. Some people are more likely to easily conceive than others. So fertility is kind of a spectrum. So when we say subfertility, it's more friendly because everyone can conceive, especially these days when we have assisted reproductive technology. Your fertility is just below maybe the normal, not that you are infertile, meaning that it's impossible for somebody to conceive. So that's why subfertility is kind of the preferred term these days as compared to infertility. Sciasis is just pregnancy. Pseudosiasis is a forced pregnancy. So we say pseudosiasis when we usually find a woman who has a belief that she's pregnant and she's having all the symptoms of pregnancy, vomiting, nausea, bloating, even edema, but the only thing missing there is the fetus. You examine her and you can't find any pregnancy there. So that is what is called pseudosiasis. It's a false pregnancy. Covered syndrome is kind of a man having symptoms of pregnancy, especially when their partner is pregnant. That is what is called the covert syndrome. So a man in this case has nausea, they are vomiting, they are bloating because their partner is pregnant. That is what is called the covert syndrome. It's kind of a pseudosiasis, but kind of in a man in this case. We have fecundity. Fecundity is we can start with fecundability. So fecundability is the probability of achieving a pregnancy in one menstrual cycle. So what is the probability that a woman can have a pregnancy just in one menstrual cycle? That is what is called fecundability. Fecundity, on the other hand, is the probability of having a live birth in one cycle. So that one cycle, a woman manages to become pregnant in one cycle and also manages to have a live birth in that one cycle. That is what is called fecundity. So those are the two terminologies. Then we move on to abortion. Abortion is really the cessation of a pregnancy before it reaches the age of fetal viability. So the pregnancy comes to an end for whatever reason, either spontaneously induced before the age of fetal viability. Then we'd call that an abortion or a miscarriage. Menopause is misused term most of the time. We hear people telling other people that this woman is menopausal, but what menopause strictly means is that last menstrual period that a woman has. That menstrual period that a woman has, the last one, is called the menopause. And we only make this diagnosis 12 months after that menstrual period. So menopause is a retrospective diagnosis. We say a woman is attained menopause when it's 1 year after last menstrual period, but her last menstrual period is what is called the menopause. Early menopause is when a woman has her last menstrual period before the age of 45. We say a woman has a premature menopause when she has menopause before the age of 40. The perimenopause is that period when the woman is going into menopause, which is the menopausal transition. So it's that period from about 35 years to about 50 years. We know that menopause on average happens around 50 to 51 years. So that process starts around 35 and until this woman eventually reaches the menopause. So she attains menopause when the last menstrual period comes. So the perimenopause is that period from about 35 years maybe up to the point at which the periods stop. So the next things we are going to describe are terminologies that we again commonly use. When we say dyspionia, we mean painful intercourse. When we say dysuria, we mean painful urination. When we say Kegel exercises, we mean the pelvic floor exercises that a woman would do to strengthen her pelvic floor muscles, her bladder muscles, and so on. Those are the Kegel exercises. Pregnancy is divided in three. So those three divisions of pregnancy are called trimesters. So the one I prefer is saying first trimester is from the point of conception up to 14 weeks. Then from 14 weeks to 28 weeks, that's the second trimester. And from 28 weeks to delivery, that is the third trimester. Amenorrhea is absence of menses. Really, that's what amenorrhea is. So it's divided into primary amenorrhea and secondary amenorrhea. So primary amenorrhea is lack of menses in somebody who's never had menses before. Secondary amenorrhea is menses that disappear after someone has had menses before. We know the commonest cause of secondary amenorrhea is, of course, pregnancy. When we say gestation age, we mean how old is the pregnancy, and the starting point of this measurement is the last menstrual period. So when we say this pregnancy is 20 weeks, we are starting to count from the last menstrual period. We need to remember that the real gestation age of the fetus is from fertilization. So it means that when we say gestation age, we are kind of overestimating the gestation age by about 2 weeks, because fertilization happens kind of 2 weeks after the last menstrual period. So the gestation age is really longer by 2 weeks, because the real gestation age of that fetus is from fertilization, and it's less than 2 weeks the gestation age that we normally write down. Then THELAC is really breast budding. This happens in when a girl is approaching puberty, she has breast budding, breast development. That is what is called THELAC. ADRENAC is development of kind of hair and all those smells associated with puberty, armpit smells, pubic hair growth, armpit hair growth. That is called ADRENAC. We know that when a woman is approaching puberty, these are some of the first things that happen. There's THELAC, which is breast budding. Then there's this rapid increase in body height. Then we have development of hair. Then we also have Menac. Menac is the time that that first menstrual period that a woman has, then we say she has achieved Menac. Molimina are kind of symptoms that women have as a result of ovulation. So bloating, abdominal discomfort, some crampy-like pain. All those are called molimina. We use this sometimes when we are taking a history and you want to kind of get to know if a woman is ovulating. So you'd ask all those symptoms of ovulation. Mittelschmerz is pain, just pain associated with ovulation. So people say it's because once a woman ovulates, some of the blood that has come from the ovary due to ovulation, the bit of bleeding, spills in the peritoneal cavity, and the peritoneal cavity is irritated. So that is what this difficult word means. It's pain that is associated with ovulation. A prime gravida is someone having a pregnancy for the first time. So you hear saying prime gravida very often. So prime gravida is somebody having a pregnancy for the first time. An elderly prime gravida is somebody who's having their first pregnancy when they're above 35 years old. So 35 years and above, that's an elderly prime gravida. A parturient is just somebody who's giving birth. A multiparous woman is a woman that has had more than one pregnancy that has gone beyond fetal viability. A multigravida is somebody who has had more than one pregnancy. A stillbirth is a birth after 28 weeks gestation age, and there are no signs of life in the newborn at birth. So that would be what we would call a stillbirth. A fetal death is kind of tricky because, like we said, a fetus, we start saying a fetus when we go beyond 8 weeks. So technically speaking, any death after 8 weeks would be a fetal death. But this terminology is commonly used for advanced pregnancies. Otherwise, the miscarriage terminology is more used. So most people would say fetal death in those advanced pregnancies, maybe above 20 weeks, above 24 weeks, because that's how fetal death terminology is used. So we say a pregnancy has reached term when it has reached 37 weeks, but we need to remember that term is a period. It's a period from 37 weeks up to 42 weeks. So term is a period and it can be divided. We have what is called early term, we have what is called full term, we have what is called late term, and we have what is called post-term. When we say post-term, what we mean is a pregnancy that has gone beyond 42 weeks. So you can say post-term, you can say prolonged pregnancy, you can say post-death pregnancy. The only issue here is that when we say post-death, when we are dating a pregnancy, what we normally, the only dates that we refer to are the expected date of delivery and the dates of the last menstrual period. So some people feel that when we say post dates, what we should be meaning is that the pregnancy has gone beyond the EDD. But in general practice, when we say post dates, when we say post-term, when we say post-dates, we mean exactly the same thing. The only thing that would be different is when you say post-maturity. When you say post-maturity, what you are saying is that you have seen the pathological features in a baby that are suggesting that the baby has been in the uterus for a long time, that the baby is really post-death. So you have evidence after the birth of the baby of those pathological features, maybe long nails, maybe wrinkled skin, maybe odd man's appearance, and so on, loss of Wharton's jelly. So all those features would suggest that this is post-maturity. So you can't say post-maturity before the baby is, before you have a newborn, you can't say post-maturity. So that is about the terminology of term and post-term. We have assisted vaginal deliveries. So normally this terminology is used when we talk about delivering a breech, for instance, where we have to assist. Maybe when the trunk is coming out, we have to make sure the cord is not trapped. When we are delivering the short excuse me, when we are delivering the shoulders, we assist. When we are delivering the head, we assist. That's an assisted vaginal delivery. An operative vaginal delivery, on the other hand, would be a vacuum delivery or a forceps delivery. It would also be a cesarean section. So those are the three types of operative deliveries that we have: 2 vaginal and 1 abdominal. Subtotal hysterectomy is removal of the uterus but leaving the cervix or part of the cervix behind. That would be a subtotal hysterectomy. A total hysterectomy would be a hysterectomy where the uterus and the cervix are removed. When we talk about a radical hysterectomy, what we are talking about is that we've removed the uterus, we've removed the cervix, we've removed maybe part of the vagina, we've removed the supporting structures of the uterus as well, the adnexia and all the ligaments that are in the supporting the uterus are also removed. That would be what would be called a radical hysterectomy. An nulliparous woman is a woman that has not had a pregnancy, that has gone beyond fetal viability. Engagement is defined as a point in labor, usually, when the biggest diameter of the fetal head has gone through the pelvic inlet. That would be engagement. It can also be defined using descent. It can also be defined using station of the fetus during labor. So when we have 2/5 of the fetal head palpable in the abdomen, meaning that 3/5 has gone into the pelvis, that would still be engagement. When we have station of at least 0, when we are doing a vaginal exam, that would be engagement as well. Effacement is really the shortening of the cervix. The cervix is like a tube, and as labor progresses, it continues to shorten and shorten and shorten from like a 5 centimeter length to a 0 centimeter length. That would be what is called effacement. Molding of the fetal head is the change in shape of the fetal head that happens to accommodate the fetal head going through a rigid maternal pelvis. So the bony pelvis is rigid, and the fetal head has to change its shape to maneuver through the maternal pelvis. That is what is called molding. A maternal death is a death of a woman while pregnant or within 42 days of termination of pregnancy. So this is regardless of the site or the size of the pregnancy, and the death is from any cause, but that cause should be associated with or aggravated by pregnancy, but it should not be due to incidental or accidental causes. A direct maternal death is a death due to pregnancy complications, meaning that when you say a direct maternal death, what you are saying is that if this woman wasn't pregnant, she would not have died. An indirect maternal death is a death due to a pre-existing condition or a condition that develops during pregnancy, and pregnancy worsens that condition. The physiological changes of pregnancy worsen that condition. That would be what would be called an indirect maternal death. Or sometimes it's the management of the pregnancy interferes with management of the condition. That would be an indirect maternal death. A neonatal death is a death of a neonate. A neonate we already defined as a baby that is less than 28 days. Preterm refers to a pregnancy that is before term, that is before 37 weeks. A macrosomic baby is a baby that has a weight of above 4 kg in our setup. Some people would say above 4.5 kg. The perinatal period is the period from the time a pregnancy reaches the age of fetal viability to 28 days after delivery of a baby. That's the perinatal period. So when we say perinatal death, what we mean is all deaths from 28 weeks gestation age to 28 days after delivery, because that is the perinatal period. The parametrium is the adjoining structures to the uterus. So there are these structures that are just next to the uterus. That is where the ovary is. That is where the fallopian tubes are. That is where the supporting ligaments are, the ligaments supporting the uterus. That is where the blood vessels are passing that are supplying the uterus. That is called the parametrium. Lightening refers to descent of the fetus before labor starts. So what you see is that there's some slight descent of the fetus when term is approaching, or when we are nearing the end of the pregnancy. That is what is called lightening. Attitude is the relationship of the fetal parts to each other, and normally when we talk about attitude, we are usually referring to flexion. So if the head of the fetus is properly flexed, we say that's a good attitude. When it's extended, we say that is a bad attitude. So attitude is the relationship of the fetal parts kind of to each other. That's a good way to define it. Height of fundus is the estimation of the size of the pregnancy by using anatomical landmarks. So when a pregnancy, the fundus of the uterus is around the umbilicus, we'll say the height of fundus is 20 weeks. When it's between the umbilicus and the symphysis pubis, we'll say that is 16 weeks. When it's just coming out from the pubic symphysis, we'll say above the pubic symphysis, we'll say that the height of fundus is 12 weeks. This is as opposed to the symphysiofundal height. When we talk about symphysiofundal height, what we are talking about is the measurement using a tape. So symphysiofundal height is reported in centimeters, so because you've used the tape to measure. But when we say height of fundus, it's an estimation using anatomical landmarks. So we usually report it in weeks, but symphysiofundal height is reported in centimeters. The booking visit is the first antenatal visit that a woman goes for. Descent is already defined as how much of the fetal head is still above the pubic symphysis. So if the whole head is above the pubic symphysis, the whole fetal head is above the pubic symphysis, we'll say the descent is 5/5. If only 2/5 of the head is above the pubic symphysis, would say descent is 2/5. Amniotomy is it's kind of surgical rupture of the membranes. You can use an amniotomy hook, you can use a coccus, that is called amniotomy. It's breaking of the membranes. Parity is the number of pregnancies that have gone beyond fetal viability, regardless of the outcome. A malpresentation is a presentation other than the vertex presentation. So when the vertex is presenting, what is presenting is the suboccipital bregmatic diameter. So any presentation other than the vertex would be called a mal presentation. So a first presentation is a mal presentation, a brow presentation is a mal presentation, a sinciput presentation would be a mal presentation. A mal position, on the other hand, is we can only define this if we know what a normal position is. So a normal position is occipital anterior position. So every time the occiput is not in the anterior position in a cephalic presentation, even in a vertex presentation, that would be called a mal position. Gravidity is just the number of pregnancies that a woman has had, regardless of outcome. We've already defined what a vertex presentation is. It's a well-flexed presentation where the suboccipital bregmatic diameter is presenting. Lie is the relationship of the fetal longitudinal axis to the longitudinal axis of the mother. That is what is called the lie. The position of the fetus is the relationship between the denominator and the maternal pelvis. So the relationship between the denominator of the presenting part and the maternal pelvis is what is called the fetal position. So when you have a cephalic presentation, the denominator is the occiput. So we'll describe something as a occipital anterior position because the occiput, which is the denominator, is in the anterior part of the pelvis. If we say right occipital transverse, it means that the occiput is on the right of the pelvis, and so on and so forth. If you are looking at the breech presentation, for instance, the denominator is the sacrum. So we can say it's right sacroanterior, it's right sacroposterior, and so on, because the sacrum is an anatomical landmark called the denominator that we are using to define the orientation of the presenting part in the pelvis. Station is the relationship between the most dependent part of the presenting part and the ischiospines. So good station is below the ischiospine, bad station is above the ischiospine. We've already defined what a denominator is. It's that anatomical landmark that we use to describe the orientation of the fetus in the pelvis. Quickening is a description of the first time that a woman feels her baby move. So in prime gravidas, this happens late, so it usually happens somewhere in between 18 and 20 weeks. In multi-gravidas, they feel the fetal movements much earlier. It happens somewhere between 16 and 18 weeks. Then we move on lastly to the common abbreviations that we use in the department. We have PE. When we say PE, normally that would be preeclampsia. HSG would be hysterosalpingogram. ARM is artificial rupture of membranes. PROM is premature rupture of membranes. CTG is a cardiotocograph. LMP is the last menstrual period. EDD is the expected date of delivery. VE is vaginal exam. You see a lot of people write FHR, meaning fetal heart rate. HVS, meaning high vaginal swab. PID is pelvic inflammatory disease. BTL is bilateral tubal ligation. MVA is manual vacuum aspiration. IUCD is intrauterine contraceptive device. APH is antepartum hemorrhage, bleeding before childbirth. PPH is bleeding after delivery. IUFD is intrauterine fetal death. You see this in the notes. TAR plus BSO is total abdominal hysterectomy and bilateral salpingo-oophorectomy. SVD is spontaneous vaginal delivery. CS is cesarean section, and IUGR is intrauterine growth restriction, not intrauterine growth retardation. So that was a presentation on common obstetric terminology and common abbreviations that we normally use. I hope you find this useful. Thank you so much for listening, and see you next time.